Design is a plan for selecting a sample and collecting the data. First, we have to look at quantitative or qualitative. Which would be most appropriate for the research question? Quantitative research will be looking at numbers and explaining and predicting and generalizing information. That means being able to use the information from this study in another setting. It is looking at statistical analysis of data. It is looking at testing of hypotheses. You're going to see the word hypothesis associated with quantitative research. And an example would be collecting data on pain perception using the 0 to 10 scale. And that's putting things in terms of numbers. Qualitative research, on the other hand, is looking at understanding. It's looking at verbal description of the meaning of experiences for individuals. Understanding the phenomenon from the individual's perspective. What does it mean to them? We may use participant observation or in-depth interviews or case studies. Examples would be collecting data on the impact of pain on a person's life. Does it mean that the person is now vulnerable or feeble or dependent? Is it a punishment? Does it mean they are wimpy? Does it mean they can no longer live alone? Or collect data using in-depth interviews or focus groups on how the individuals deal with pain in their everyday lives. They're looking for trends and similarities. You're going to see words such as themes. They're looking for themes. What is it that everybody or a lot of people seem to be talking about? And coding is how they actually analyze the data in qualitative research. The next issue to look at is experimental versus non-experimental. What's going to fit the research question best? In experimental research, we're manipulating something. We're controlling some things and manipulating other things. Again, you may look at true experimental, quasi-experimental, or pre-experimental design, and that was in your readings. Non-experimental research can be descriptive, where it systematically describes an existing situation. Example, did the patients have pain after a procedure? It could be correlational, examining the relationship between existing variables. Is there an association between the pain scale rating and the speed with which they get out of bed? That association, that's a correlation. It's a correlational design. Maybe the people who get out of bed have less pain. Remember, this does not imply causation. Maybe getting out of bed eases pain, but it may be that they get out of pain sooner because they're in less pain. So which came first, the chicken or the egg? Which came first, the pain or the getting out of bed? You don't know in this design. Again, it does not indicate cause and effect. Our next question is retrospective versus prospective. Retrospective, the data is collected in the past, but it's analyzed now. We may go back and look at old hospital charts. We may look at diaries or logs. What were the post-appendectomy pain experiences of people prior to the invention of PCA? That's a retrospective study. Prospective, data is collected and analyzed in the present. How do people rate post-op pain after an appendectomy? Cross-sectional versus longitudinal. Cross-sectional data is collected once. The researcher may take a long time collecting data from each individual, having to meet with person A, person B, person C, but each participant only gives data once. There is no follow-up or monitoring over time. What is the length of stay for people having an appendectomy at Hospital A versus Hospital B? How long do people between 20 and 40 years of age stay in the hospital versus people who are 60 to 80 years of age? From these two different questions, we've now come up with 4 possible research designs. Retrospective and cross-sectional. Data is collected on each subject once, but it's collected in the past and analyzed now. Retrospective and longitudinal. Data is collected on each subject multiple times from the past, but it's analyzed now. Again, both of these could be done through chart audits. Prospective and cross-sectional. Data is collected on each subject once, and it's collected now. Prospective and longitudinal. Each subject has data collected multiple times, but it's in the present. We're not looking to the past. We're actively collecting it now. Longitudinal. Follows a cohort or a group of subjects over time, collecting data at various times. Each participant contributes data at several points in time. How do pain ratings change for people with rheumatoid arthritis over a 10-year period? That's a longitudinal study. Do people who live alone and have rheumatoid arthritis have more pain-related incidents than those who live with a family? Again, that would be a longitudinal design. So now we have 4 different study types based on the concepts of time. First one is retrospective and cross-sectional. Data is collected on each subject once, but it was collected in the past, and it's analyzed now. We can go back and look at census data, or look at incidents of measles at a particular point in time. That is retrospective and cross-sectional. The second one is retrospective and longitudinal. Again, we're looking in the past. Data was collected in the past, but it was collected at multiple points in time on each individual that you've identified as being in the study. This might be going back and looking at the hospital records of people who went in for an appendectomy. Let's look at what their fevers were like, or what their pain scales were like over the 3, 4, 5, 6, 7 days or 2 weeks at some point. In the past history, people stayed in the hospital forever. Let's look at what the pattern of their fevers were. The third one is prospective and cross-sectional. Remember, prospective means now. We, the researcher, are actually going out and interacting with the individual and collecting data. Because it's cross-sectional, we collect it once on them. Then there's prospective and longitudinal. Again, we as the researchers are collecting data. We are the ones actively interacting with live human beings, collecting data, but we're interacting with them over a longer period of time. We may go in and say, okay, let's follow the pain scale of how somebody does the first 48 hours after having an appendectomy. Let's look at their pain when they use PCA versus if they use the Q system.